In the G60 program, we began using the Vulnerable Adult Survey, or the VES-13, as a way to help determine people's level of function and to help start planning for their discharge as soon as they are admitted to the hospital. By measuring what their level of function was prior to their injury, we can better determine where they may have to be placed at discharge, whether that be home, acute rehab, or a skilled nursing facility. Patients who are going to go to any kind of a rehab facility generally need to have at least 2 services that say that they need rehab services. So if you can tell by someone's VES survey that chances are they're not going to go home, then you can be sure you have the various therapy services seeing them as soon as possible. The VES-13 survey actually has only 4 parts. It takes less than 4 minutes to complete, and you don't even have to have someone who is a healthcare professional do it because it's just very simple questions. One of the things to keep in mind with doing the VES-13 survey is you don't have to be able to ask the patient what their function was prior to coming in. You can ask either the patient or their family. The first question just has to do with how old is the person, and they don't even score any points until they're 75 or older. Next comes their self-assessment of their health. How do they compare their health compared to people their own age? Do they think they're in good health, fair health, poor health? Then we move on to what tasks, common tasks can they accomplish, and then what kind of physical traits. So for instance, although you may not want to wash the baseboards of your home, would you be able to do it? Would you be able to scrunch down and wash a baseboard? How far can you walk? And it goes from can a person walk simply across the room to can the person walk a quarter of a mile. Then it asks some other questions such as, are you able to go pick up your own prescriptions? Are you able to balance your own checkbook, or does someone need to help you? What kind of tasks can you do at home? Are you able to carry a plate from the dining room to the kitchen? These numbers then you look at what does the person totally score. If a person scores less than 3, then they're considered not to be a vulnerable elder. If they score 3 or greater, then they are considered to be vulnerable, and the thought is that they may lose some of their function by whatever their injuries are. They have about a 50% chance of having a functional decline while they're in the hospital. People who score more than 3 points, 40% of those people will probably not be discharged to their home. They will go to some sort of a rehab facility, whether that be an acute rehab or a skilled nursing facility. Where this becomes really important is when you're planning their discharge and you have to go through all those hoops of getting insurance approval and making sure you have all the therapy services that are needed to see them and have notes on the chart so that you can get people discharged as soon as possible. I think, as we all know, the longer someone stays in the hospital, there's a lot of sick people in the hospital, there's a lot of germs in the hospital, so obviously getting people discharged as soon as possible is very important. The other thing that the VES-13 helps us do is to look at people as individuals. We often say now that 60 is the new 40 and 80 is the new 60. Well, we have people come in that are 80 and they have a better functional scores than some of the patients we see that are 40. So you can't just compare an 80-year-old to every other 80-year-old. You can have them compare themselves, and you can actually have some numbers that by research have proven that people tend to do better or people tend to do worse depending on what functions they can accomplish.